Hi everyone, we have a Summit project presentation called A Healthcare Communication Tool That Saves Time and Money with Just a Click. Presenting for you today is Laura Hooker. Laura, please go ahead.
Hi, this is Laura Hooker. I am the Shared Governance, Innovation, and Technology Council Chairperson, and our project was called A Healthcare Communication Tool Saves Time and Money with Just a Click. Our team members include myself, Julia Davey, RN Co-Chair, Laura Cunningham, RN Secretary, Lisa Andronica, BSN RN Mentor, Laura Goki, RN IT Advisor, Trish Chartier, BSN RN, Hugh Wen, RN, Gabrielle Quinn, RN, and Brent Landis, IT. The purpose and background of our project was to find a way for us to relay patient-specific information in a HIPAA-compliant text messaging platform. We hope that this would be utilized throughout the organization as a way to relay important patient-specific confidential information between providers and staff, alleviating the need for paging and callbacks. Qlic was initiated in our organization without a real way for us to decide who had access to it and who needed access to it. Upon looking at the Qlic usage reports generated by our IT department, we determined that there were a large number of users who no longer needed access based upon their employment status or their job title. It prompted our council to look further into this and determine whether or not Adirondack Health had a way of streamlining the onboarding process of new employees and deciding who needed access and who didn't need access. Because as we looked into our user list, we found that we were paying $7 per user per month for the utilization of the Qlic platform, which if people are not utilizing this, there's no reason for our hospital to be paying for it. So our Shared Governance IT Council determined a process of reviewing the Qlic users and further determining a review that would need to take place. We set up a quarterly basis for review and found that as we looked through the process and streamlined our goals, we found that there were less users that needed access to it over time and less people that we would be paying for. Over the tenure of our initiative, our council reviewed access of 516 Qlic users, and upon that, we found that there were 265 users that did not need access to Qlic during the 2019 year. And that saving our hospital $21,084 by deleting them as users in the Qlic platform due to their not needing access. The objectives for our plan were to develop a way for us to determine which employees required Qlic access. Objective 2 was to execute a cost-saving strategy by eliminating unnecessary Qlic users. And Objective 3 was to implement a hardwired system to track and update our Qlic Active Directory user list. That way we were streamlining the process as well as saving the hospital money. The domains of quality for our hospital that were addressed in our project were safety. We found a HIPAA-compliant secure text messaging way for us to transfer patient information from provider to user and nurses. We found an efficient way for us to provide information to the providers as far as sensitive information, and found that we could do it in a secure way rather than waiting for pagers and callbacks. We found an effective way for us to implement a sustainable hardwired check and balance process by assigning only users who needed Qlic access Qlic privilege. Person-centered care. Qlic is a HIPAA-compliant secure text messaging platform. This allows us to share patient-specific information between providers and the healthcare team. Our plan of action was as follows. The plan was to develop a strategy to review the Qlic active user list and then compare it against the Human Resources Employee Termination Report and job descriptions. Upon determining users that no longer required access, we could request that the IT department removes that user from the Qlic platform, therefore saving us money. Brent Landis in the IT department was our go-to person for this task. Over 2019 calendar year, the Shared Governance IT Council reviewed over 516 users of Qlic and determined that there were 265 users no longer requiring access to Qlic, which the organization was paying $7 per user per month. We did an extensive Qlic user list run and reviewed each user of that list. Our council members, over the course of 1 to 2 months, cross-referenced with department heads, users, and human resources regarding employment status and title. This allowed us to not have anybody on the Qlic user platform that did not need access or did not currently work at the hospital anymore. Upon careful review of our Qlic Active Directory user list, the submissions for removal were sent to Brent Landis, and the cost savings began the month following user removal. In the pie graph on our presentation, you can see in red where that the largest number of users were deleted in January 2019. 218 users were removed that period of time, saving the hospital $18,312 for the year, starting January through December. In July, we did another review where we removed another 20 users, saving us $1,680. And in December 2019, the number was even less because we had found a way to not onboard people into Qlic that didn't need access. So you can see in the beginning of 2019, we went from a large number down to only 13 users in December. Total savings for the hospital and organization was $21,084 for 2019. The outcomes achieved were that we reviewed and removed 251 users not requiring Qlic access. We reported our savings to the Transition Action Plan, or the TAP, for Adirondack Health and saved approximately $21,084 by removing the users. We established a quarterly review system to determine users who no longer require access to Qlic in our organization. Conclusions and lessons learned. We realized department directors had to be educated about the policy regarding the types of employees who should be provided Qlic access when they're onboarding a new employee. Our IT department was also helpful in allowing us to see who had access and who had been given access that no longer needed it. Now that a system of review has been established, the number of users requiring removal decreased and should continue to decrease significantly. Thank you for your time, and congratulations to all the submissions. If you need to get a hold of our council for any reason regarding this policy, please feel free to reach out to myself at lhooker@adirondackhealth.org, or you can reach out to Lisa Andronica, our mentor, or any of the people on our council. Thank you for your time.
Okay, thank you, Laura, for that presentation called A Healthcare Communication Tool That Saves Time and Money with Just a Click. Thank you.